Hi. Okay, so I have gone ahead and finished writing up my chart note that's going to go into Patriot's chart, and basically said that I did not see any casts or any crystals in the urine sediment that we looked at under the microscope. So that's ready to go into his chart. As far as things that you might sometimes see or that I've seen in the past, I have some pictures. Starting off with some casts. The top one is a Highland cast, and these bottom two are white blood cell and red blood cell casts. Now the Highland casts are most common, the most common casts you'll find, especially in renal diseases associated with proteinuria. They're transparent and they're difficult to see unstained. And for the cellular casts are almost always abnormal. They come from tubular disease, from toxins or hypoxia. You'll get epithelial casts. Red blood cell casts signify tubular hemorrhage, and white blood cell casts signify inflammation. Okay, now the next picture I have, I've got some fatty casts right there. And I've got some waxy and granular casts. Now the waxy and granular casts, well, the granular casts signify tubular cell necrosis and degradation. And the fatty casts, or waxy casts, excuse me, signify severe or long-standing renal disease. Now the fatty casts are basically granular casts with increased lipids. And they can be normal in cats, but they're often seen in patients with diabetes. The fatty casts are. Now, as far as crystals go, you will see, let's see, commonly we see struvite crystals. We see calcium oxalate dihydrate crystals and calcium oxalate monohydrate crystals. We see ammonium biurate crystals and cysteine crystals. Now the struvite crystals, also called magnesium ammonium phosphate or triple phosphates, they kind of have a casket appearance to them. They have 6 to 8 sides or squares like prisms. They have a central ridge and they look very three-dimensional. They're neutral to alkaline pH, that's where they're found. Uroliths might be present if you're seeing struvite crystals, and it might be an incidental finding if, for instance, if a refrigerated sample is not warmed back up to room temperature. Now for the calcium oxalate dihydrate crystals, those are common. They're incidental, seen in bacterial infections. You might see them in Cushing's. You might see them in pets that have a very high, like a very oxalate rich, a vegetable-rich diet. They are found in neutral to acidic pH, and they can form with refrigerated storage. They have an envelope appearance, kind of like little gift cards. Now the calcium oxalate monohydrate crystals, those are found with ethylene glycol toxicity, and they're found within 3 to 6 hours to 18 hours of ingestion. They have a picket fence board appearance and they're very flat. They have parallel sides, they're pointed, they do not look 3D at all. Let's see, the ammonium biurate crystals, those are pathologic. They signify hepatic failure or increased blood ammonia, and they have a thorn apple appearance. They almost look like sarcoptic mange. Dalmatians and bulldogs are 2 breeds that may have these normally. And for cysteine crystals, those are found in neutral to acidic urine, and they are a risk factor for uroliths. They come with inherited defects, male dogs, and either gender feline. They're 6-sided flat plates, and they kind of bud off of themselves 3-dimensionally. And they are radiolucent. So those are crystals that you might see. Now as far as cells, Red blood cells, they're small and round. They have a slight orange tint and a smooth appearance. Normal urine should contain less than 5 red blood cells per field. Increased red blood cells indicate a hemorrhage somewhere in the urogenital system. So here, and then white blood cells, I have a picture. White blood cells are slightly larger than the red blood cells and have grainy cytoplasm. So here you can see both of these in these pictures, that the red blood cells are the arrows and the white blood cells are the arrowheads. Okay, and epithelial cells. Transitional epithelial cells are a common urine contaminant. They resemble white blood cells, but they're actually larger. They have a greater amount of grainy cytoplasm and a round, centrally located nucleus. In avoided urine samples, squamous epithelial cells may be seen. Occasionally, in an animal with transitional cell carcinoma, you might see neoplastic transitional cells. Or neoplastic squamous cells might be seen in an animal with squamous cell carcinoma. And so those are a few of the things that you might find while looking under the microscope at urine sediment during a urinalysis. And so that concludes task 20, performing urinalysis. Thank you. Hi, when I was doing the chemical composition of my urine this evening, I realized after watching it back that I said there was no glucose or protein in the blood, and what I should have said was there was no glucose or protein in the urine. And it's because we were doing a urinalysis, not testing blood this evening. So I apologize for that glitch in the video. Thanks.